Employees beware. There's a new survey revealing that many big companies in America will soon pass the burden of rising healthcare costs on to you, the worker, according to the National Business Group on Health. Businesses will be turning to workers to help pick up the bigger tab for providing insurance under the overhaul. Republican Senator Orrin Hatch weighing in, saying this is the latest proof President Obama's law has to be repealed. Charlie Hurt joins us. He's a columnist with the Washington Times. And Dr. Sridhar Pattarazu is CEO of Vital Spring Technologies. Thank you as well. And Doctor, let me begin with you. Do you think the government has in some ways failed to create incentives to help companies deal with the rising healthcare costs? And thus, isn't it inevitable that the new costs are simply passed along to the workers?
Yes, Greg, absolutely. They fail to create the right incentives. Insurance companies have been able to gain more market share at the expense of employers in terms of raising premiums, and nothing within the mechanics of the law has enabled employers to combat this. So they really have no choice but to push that cost over to employees now that they're forced to provide coverage under the new law or pay the penalty.
Well, if you were to rewrite that law, Doctor, I mean, what provision or clause or incentive would you insert into it to resolve this dilemma?
The first thing is we should have provided some kind of credit to the employers to enable them to get the information they need in order to hold the insurance companies accountable. This has never happened within the U.S. healthcare system today, and this has been a huge domino effect where the employers have never been in charge. And so the mechanics and the economics of how the law was devised doesn't provide for that. And this has been the fundamental mistake that has been made over and over again. And I've said this many, many times, you know, as I've been on Fox and other stations.
You know, Charlie, Senator Orrin Hatch is laying the blame, at least partially, at the feet of the president and his new health care reform law. Is that fair or unfair?
Well, I think that it's fair in one respect, and that is that it reveals the failure of the law. This would be President Obama's signature piece of legislation. It reveals the failure of that legislation to stop the rising health care costs, which is what the whole thing was intended to do. And while Republicans and Democrats can get into a big squabble about about when different parts of the law were supposed to kick in or not kick in. In 2012, in the election, President Obama has said that that this law was to control health care costs. And when voters start having to pay higher health care costs as a percentage of the overall cost, they're going to remember that, and it's going to hurt him.
Doctor, if more costs are shifted onto the backs of workers, aren't they naturally going to be seeking less medical care? And if so, what impact does that have overall on the health care system?
It's a huge issue. If you look at what's happened to the economy in the last couple of weeks, I'm hearing stories from doctors where patients can't afford the co-payment, let alone now the greater burden of the co-insurance. So they're not showing up for their doctor's appointments, or they're not getting their prescriptions filled, which means that the people with diabetes or hypertension are going to end up in the emergency room because they aren't taking care of their condition. They're not getting the care when they need it, and costs are going to go up. We put in the law and the mechanics of it to try and bring down less utilization of ERs, to put in mechanics to try and build more prevention, but the opposite is happening. People can't afford to go to the doctor. They can't afford to get their prescriptions filled. So we've created a monster here.
And Charlie, quick one, because I'm almost out of time here, but it may get worse because the companies that provide these very generous plans realize that beginning in 2018, they're going to get taxed very, very heavily. So they're working right now to reconfigure their plans, and that means even more of a burden on workers. Won't that just compound the problem?
Absolutely. And you hit on a crucial point, Greg. The way out of this problem that we have is to make patients better consumers, better purchasers of health care. And that's a step in the right direction. The Obama health care legislation does the exact opposite. It reverts everything so that the government will end up picking up the tab, and we become even worse consumers, and therefore there's less competition in the marketplace, and healthcare costs will continue to go up, and will until you know, the government decides, okay, well, we can't afford to pay for this person's health care anymore.
Charlie Hurt, thanks so much for being with us. Dr. Sareed Patarazu, thank you as well, sir.